Okay, so this is James Burgess, this is Sports and Exercise Medicine Diploma. This is our examination of the hip and groin if the patient's got any problems in that area at all. So we've got our volunteer here. The first thing that we're going to do is just get him to stand up. Crouch down the camera. Yeah, sorry, it's sometimes difficult getting the picture there. So if you just put your feet together there, what we're looking for is normal alignment. There's no valgus issues with the knee, no varus deformity. There's any deformity, so the knees are obviously in alignment here. There's no issues at all. We would tend to get a tape measure to look for any issues with leg length discrepancy. So we've got apparent leg length, which is from the pubic tubercle to the medial malleolus, and then we've got true leg length from here, from the anterior left spine to the medial malleolus. So we might want to do that and see if there's a leg discrepancy, as that might be relevant in this situation. Now again, we're going to test gait here. So if we're just going to walk to the wall there and back again for me. So we're just looking for any pain, that might help us localise what the problem is at all, and we can take it from there really. So if you'd like to take a seat there, and then you just turn facing that wooden thing there. So we're not going to expose this patient's back today, but we might want to do a full examination of the back, because hip and groin pain can be radicular pain from the back area. So we might want to do that. And what we'll be looking for is any abnormalities with the spinal alignment. So actually this patient's spinal alignment is completely normal, don't have any issues with that. We're just going to do a quick palpation down the midline here. And so we'll just do a quick palpation down the midline to make sure there's no bony tenderness there. Certain sports, particularly cricket, fast bowling, they might have a stress fracture of the back there. That might be manifesting with some pain in that area there. And it's possible if that's lower down, that might radiate to the hip and groin area. So that's why we're looking into that. Just do a few movements of the spine while the spine's here. So it's fixed in this position. So if you just like to tilt, we'll try and fix the pelvis here. You try and tilt your back up and down. So we're looking for any pain, there's good range of movement there. Okay, if you'd like to bend forward for me, and then bend backwards. So we're looking for any lack of flexibility there, any pain, movements like that. And we're looking to see if that exacerbates any of the symptoms the patient might have in the hip and groin area really. So again, that's normal stuff. So if we just get your head on this end here. So now we're going to just, if we were still worried about radicular pain, we might do a straight leg test, looking for any symptoms that might occur on doing straight leg raise test, sorry. So we'll just do it on this leg. So if you just bend your knee up here for me. Okay, so what we're going to do here is, he's eager to do that. So what we're going to do is we keep the leg like this, but then we're again going to try and extend the leg and see if the patient's got any pain. Do you have any pain at all there? No. If this was a positive test, if we did that and there was any tingling or numbness below the knee, not pain in this area, but anything that's below the knee, then that could indicate a positive straight leg raise test, and we might then go on to investigate for a radicular type of pain. So we don't need to do that necessarily. So because we're in here, we won't be exposing the patient today, but it is sometimes important to expose the patient to see if there's any abnormalities you can actually see. So if the patient had lateral hip pain, we might examine the lateral hip area. So this would be in this area here, near the greater trochanter. We do know that lateral hip pain could be from a trochanteric bursitis, in which case there might be tenderness or swelling in this area, and there might be tenderness and swelling places farther down. We won't actually be examining buttocks today, but there might be some pain and tenderness coming from the gluteal muscles, and as we know, the gluteal muscles insert into the greater trochanter area, and that could be causing some of the patient's symptoms. So it's important to examine for that. We won't be examining for hernias today, but in the groin area here, so this area here, the hernial orifices, you might have a swelling, you might have pain in that area, and to elicit that further, you might ask the patient to cough. So if you wouldn't mind coughing for me, it might be expected that if the patient had a hernia, it might be apparent on coughing, or getting the patient to stand upright, as that might be a reason for the patient's pain, because they might have a hernia there. In males and females, the most likely cause is an inguinal hernia. In females, a femoral hernia is more common than in males, but inguinal hernia is still more common. The other thing as well is if the patient had pain more in the groin, but it was more in the midline, you might have some tenderness over this area, which is a pubic area over the pubic bones, and that might indicate, say, an osteitis pubis, and that could be investigated for with some relevant imaging and such like with that. So it's important to examine the patient to identify what the cause of groin pain might potentially be. Now we'll go on to examine for just basic examination of motor and sensory examination of the legs, make sure we can see if there's any abnormalities distally that could indicate a myopathy, this would be an unusual presentation, but it's possible, and to rule out radicular type of pain. Can you, so you ask basically show, so a very quick examination. Can you feel me touching your feet here? Yeah. You bend your feet up. So it's a very basic distal examination, and down. So distally, the motor and sensory component is normal here, so we don't have any strong suspicions that the patient has a radicular focus of the pain or any obvious weakness in power or anything of that description. So now we'll go on to doing examination of the hip. So if you'd like to lift the leg up straight for me. So we're going to do it on one leg. Obviously it's important to do it on both sides to make a comparison, but we're just going to do it on one leg here for the purpose of this video. So if you'd like to lift that up, so he's got a good range of movement there in the hip, there's no problems with that. And if you just pull out to the side, so we're going to test abduction with this. Okay, so that's fine. And then adduction, adduction this way. So a good range of movement there. We're just going to very quickly compare those range of movement there and out to the side there. So it's got a good range of movement. Of course, unfortunately, all on the way there to full range of movement there. Now I'm going to do internal and external rotation of the hip there. We're just going to lift up the leg. So for internal rotation, we're actually going to move the distal leg out to the side. And it might elicit pain if someone had a problem with the hip joint there. There might be some pain on that. And again, external rotation would be out to the side here, out to the side of the proximal leg, but the actual distal leg moves inwards to there. And again, we compare that on both sides to assess the range of movement to make sure it is the same. So we've done that. Then we would go on to just test for extension. So we actually need the patient to roll over into your phone if you don't mind. So we're just going to test for extension here. Okay? And there may be, if the patient is exposed, there might be some apparent issues with changes in muscle bulk that you might see here. The major muscles here, obviously you've got the hamstring muscle here. This inserts into the ischial tuberosity, that area there. So there might be some pain in that area if you were worried about that. So you might want to pop over. But on this patient, we don't have any concerns about that. So if you'd like to move forward here. Okay, so it's got a good range of extension there. Obviously, it's a bit difficult if he's not wearing sportswear to make that easier to achieve. Okay, so if you'd like to turn over for me, please, that's great. So if we were worried about the this is part 2 of the hip and groin examination. There was a technical problem with the camera, so we're just completing our examination there. So we've done the range of movement of the hip. We have looked at the hip as well. If we have got any concerns about a few issues like a snapping hip or a sacroiliac joint, we would do certain investigations. So if we were worried about sacroiliac joint, get the patient to roll to the foot here. We would then press on this area, the lateral hip area, more pelvic area. Any pain there at all? No. That's compressing the sacroiliac joint. So if there was pain there, we worry about sacroiliac joint. If we get the patient to stand up, we just do a stalk test for that, okay? So the patient would stand on one leg, would bend back against the hip. On the affected side, and you can relax now, if the side that's supporting the weight, you're bending back into that, if there was pain there, that could indicate sacroiliac joint involvement there. If you'd like to go back there. If we were worried about a stress fracture, we would then percuss down the leg from the heel, bony prominences, percuss in the greater trochanter area, and maybe percuss in the distal femur. If there was pain transmitted to the groin, it is difficult to assess for this. If there was any pain in that area, that could indicate a stress fracture, and that might need to investigate further. That's all. If we're worried about a snapping hip, which is a common issue that people can have an issue with, and if that was, we were worried about that being in the groin, causing groin pain, we would then get the hip to be flexed again. And this is usually detected at the end of the range of movement, okay? So if you bend the area there, and then we're also just going to do a few movements of internal and external rotation in that area to see if any pain is elicited. Any pain elicited there, any pain that you've got there at all? No, so there's no pain that the patient has, so we're not too worried about it. There's no obvious snapping of the tendon when we did that. If we were worried about any pathology when we were flexing the hip, any pain associated with that, and it was being transmitted up until the, not really the pelvis, but higher than that, into the lateral hip area, then we might want to palpate in this area here, because the anterior superior iliac spine is the origin of the sartorius muscle, which goes from here and inserts below the knee there. So if any pain in that area, we might want to investigate that. For the fourth rectus femoris, which is the anterior inferior iliac spine, then we would look into that as well. And if we had any worries about muscle bulk or something, then we would just quickly investigate the muscles at all. So if we just bend the hip at all here, and just try and resist me there. So this is, we've actually got the knee bent in this situation here. So the two hip flexors, the two flexors here are the iliac psoas and some of the hamstring muscles as well. Not hamstring muscles, the quadriceps as well in this area. So we just, when we do that, that's what we're testing for there. Extension, we've done that at the back previously, but if there was any, when we're trying to resist that movement, any pain at all, then we might be worried about some gluteal pathology in that area at all. Tensor fasciae lata runs in this area, so if you try and resist me there, any pain on abduction could indicate a tensor fasciae lata issue, and then any pain, if you move your hip, so any pain on adduction could indicate an issue with the adductor muscles, like adductor magnus, that kind of stuff. That concludes our examination of hip and groin. Thank you very much. Cheers. Thank you.